Hi, I'm Kevin Eckhoff from the Community Relations Department here at Passavant Hospital. Laboratory is in the news this week because it's National Medical Laboratory Professionals Week. We're going to take a look at what the lab professionals do here at Passavant. Let's go inside and take a look.
She wants to be the right one.
Hi, my name is Trudy. This is our specimen dispatch department. This is where we package our specimens that we are going to send to our reference labs. We average about 950 specimens a month that we send out to reference labs because not every test is cost effective to be performed here in our laboratory.
Hey, welcome to hematology. This is where we have 4 different areas of specialties in hematology, which includes, of course, hematology, coagulation, serology, and urinalysis. This is, in hematology, this is where we actually do CBCs, which include white counts, hemoglobins, hematocrits, and platelet counts. And as we move over to our other area in hematology is urinalysis. This is where we perform urinalysis with our test strip analyzer. And this is where the strip includes like glucose and blood on the strip to help the doctors find out the status of their patients. And as we move over here, I can show you coagulation. It's another part of our hematology area. And as you can see, this is where we perform our coagulation testing, which includes protimes, BGTs, fibrinogens, and D-dimers, which gives the doctor the coagulation status, and that helps them determine how they're doing. Oh, and as we move over to another section of the hematology area, we have serology. And this is mostly done manually, and it's usually testing antibodies and antigen reactions. And those tests include mono testing, rubellas, RPRs, HIVs, and pregnancy testing. So I hope you enjoy your hematology and laboratory week. Thank you.
My name is Carol. This is the microbiology department. If a physician suspects that a patient may have an infection, they would order tests that are done in this area of the laboratory. We don't actually get many blood specimens in this department. Most of our specimens come from other sites in the body. These might include such areas as a urine, a sputum, a tissue, or a swab of a wound or of your throat. The majority of our testing starts when we plate media. This media allows the bacteria, if it's present, to grow and be identified. If we detect a pathogen, we do an additional test called a sensitivity. These sensitivities will allow the physician to know which antibiotics he might prescribe to treat the infection. If we get a blood culture as a specimen, it's in a bottle like this, and we place it in an incubator. It's left in that incubator for 5 days where it is tested before we report a result. Most of the testing in this area of the laboratory takes approximately 48 hours to complete. However, we do have rapid testing with a quicker turnaround time. Some of these tests would be one that tells the doctor if you have the bacteria that causes strep throat or the virus that causes the flu. These are important tests because they aid the physician in confirming or ruling out a diagnosis.
Welcome to the chemistry department of our laboratory. Here we do several different tests. Most of these tests are on profiles where we group tests into one thing that tests similar functions to help determine what might be going on in the body. One of our most basic tests is the basic metabolic profile, where we test basically glucoses, electrolytes, and kidney function. And these can help tell if you're having kidney disease, or if you're dehydrated, or if your blood sugar is too high and you may be diabetic. We put them on this machine here to analyze them. Most of all our testing done here is done electronically on analyzers, which helps testing get done extremely fast, so the doctors can get quick results and treat you fast.
Hi, my name is Dawn Smith. I'm the blood bank supervisor here at Passavant Hospital. Our job here in the blood bank is to find compatible blood for patients for upcoming transfusions or surgeries. Patients may receive transfusions for multiple reasons. They may come in through the emergency department with internal bleeding. They may have blood loss or anemia, or they need blood for an upcoming surgery. Once the doctor determines the patient needs a transfusion, he would order a test called a type and screen. Through that testing, we can determine the patient's blood type, then we select a compatible blood product. What this is here is a packed red blood cell unit. The red cell units that we receive are provided by volunteer donors from the Community Blood Center in Springfield. Our inventory in these refrigerators is completely dependent on volunteer donors, so we hope that you come out and donate.
Hi, I'm Maureen. I'm the cytotechnologist here at the Passavant Laboratory, and I screen pap smears and other non-gynecological specimens, looking at the cells, trying to find malignancies. I'm an assistant to the pathologist, and what I do is I look under the microscope and I look at the cells, and if I find something abnormal, then I show that to the pathologist. It's a very time-consuming, little bit tedious operation, but it's very rewarding when we can help the patient and find some cells that can be treated.
My name is Hillary Stice, and I am one of 2 histotechs here at Passavant Hospital, and we compose of the histology department. Our main purpose is we usually get specimens from surgery and from doctors' offices in formalin. We give them an accession number. We bring all the specimens to our grossing table for the pathologist to gross. During gross, he gives a thorough description, places the specimen in cassettes, and then we place the cassettes in our tissue processor overnight. And then when they come out, we come to our embedding station and embed each tissue into a paraffin block. And then we come to our microtome to cut thin sections at 4 microns each of the tissue. We pick the best section, put it on a slide, bring the slides to the automated stainer cover slip, and then bring all the slides to the pathologist to render a diagnosis.
Sets of customers.